Uretron D-S is used to relieve discomfort, pain, frequent urge to urinate, and cramps/spasms of the urinary tract caused by an infection or medical procedure. It contains methenamine, an antibacterial drug, and methylene blue, an antiseptic to prevent the growth of bacteria in the urine. It also contains salicylate for pain relief and an ingredient to make the urine more acidic, which helps methenamine work better. Hyoscyamine, an antispasmodic drug, relaxes the muscles of the urinary tract to relieve cramps/spasms. It's important to note that this medication should not be used to treat a urinary tract infection, and it's not recommended for children younger than 6 years due to potential side effects. When taking Uretron D-S, it's important to follow your doctor's instructions. Usually, you will take this medication 4 times a day with a full glass of water. Make sure to wait at least 10 minutes before lying down after taking it. It's also essential to drink plenty of fluids unless your doctor advises otherwise. If you experience stomach upset, you can take Uretron D-S with food. The dosage of this medication depends on your medical condition, age, and how you respond to the treatment. It's crucial not to increase your dose or use this drug more often or for longer than prescribed. Taking antacids may reduce the absorption and effectiveness of Uretron D-S, so if you're also taking antacids, make sure to take this medication at least 1 hour before them. To get the best results, take Uretron D-S at regular intervals. It's helpful to take it at the same times each day to help you remember. Avoid consuming large amounts of caffeine, such as coffee, tea, colas, and chocolate, as it can increase the side effects of this medication. If your condition does not improve within a few days or if you develop signs of a urinary tract infection, such as burning, painful, or frequent urination, make sure to inform your doctor. Some common side effects of Uretron D-S may include nausea, vomiting, dry mouth, dizziness, drowsiness, blurred vision, or constipation. To relieve dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. This medication may cause urine and sometimes stools to turn blue-green, but this effect is harmless and will go away when you stop taking the medication. Remember that your doctor prescribed this medication because they believe the benefits outweigh the risks of side effects. However, if you experience any serious side effects, such as hot/dry/flushed skin, decreased sweating, eye pain, difficult urination, or signs of kidney problems, contact your doctor immediately. In rare cases, this medication may cause extremely high blood pressure, which can be fatal. If you experience severe headache, fast/slow/irregular/pounding heartbeat, chest pain, neck stiffness/soreness, severe nausea/vomiting, or other serious symptoms, seek medical help right away. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. Remember to talk to your doctor about the best time to take this medication and the appropriate dosage for you. Before taking Uretron D-S, it's important to let your doctor know if you have any allergies, including allergies to aspirin or NSAIDs, belladonna alkaloids, or any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to talk to your pharmacist for more details. Let your doctor or pharmacist know about your medical history, especially if you have kidney or liver problems, urinary blockage problems, difficulty urinating, stomach or intestinal disorders, glaucoma, heart problems, high blood pressure, myasthenia gravis, bleeding or clotting problems, certain enzyme deficiencies, aspirin-sensitive asthma, growths in the nose, stroke, frequent headaches, a certain type of adrenal gland tumor, or dehydration. Uretron D-S may cause dizziness, drowsiness, or blurred vision. Avoid driving, using machinery, or doing activities that require alertness or clear vision until you know how this medication affects you. Limit alcoholic beverages, and talk to your doctor if you use marijuana. This medication may make you sweat less, increasing your risk of heat stroke. Avoid activities that may cause you to overheat, and make sure to stay hydrated and dress lightly in hot weather. Seek medical help if you experience a fever that does not go away, mental/mood changes, headache, or dizziness. Before having surgery, inform your doctor about all the medications and products you use. Children and older adults may be more sensitive to the side effects of Uretron D-S, and there are specific precautions for children and teenagers regarding the use of aspirin-related medications. If you are pregnant or planning to become pregnant, discuss the risks and benefits of using this medication with your doctor. Uretron D-S can pass into breast milk and may have undesirable effects on a nursing infant, so be sure to consult your doctor before breastfeeding. The use of Uretron D-S can interact with many other products, including some prescription and non-prescription drugs, as well as herbal products. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Uretron D-S may increase the risk of bleeding when taken with other drugs that also may cause bleeding. It may also cause a serious, possibly fatal, drug interaction when taken with other MAO inhibitors. It's important to avoid taking certain medications with Uretron D-S, and to report the use of other drugs that may increase the risk of extremely high blood pressure when combined with this product. If you are taking azole antifungal drugs, you should take Uretron D-S at least 2 hours after the antifungal drug. Also, be cautious about combining Uretron D-S with medications that cause drowsiness, and make sure lab personnel and all your doctors know you use this drug as it may interfere with certain lab tests. If you suspect an overdose or notice someone experiencing symptoms such as passing out or difficulty breathing, it is crucial to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include fever, rapid or pounding heartbeat, severe dizziness, seizures, slowed or shallow breathing, and unusual excitement. It is important to act quickly in these situations to ensure the safety and well-being of the individual. It is important to remember not to share Uretron D-S with anyone else. This medication is specifically prescribed for your condition and should not be used by anyone else. If you forget to take a dose of Uretron D-S, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When it comes to using Uretron D-S, it's important to store it at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. And when you no longer need the medication or it's expired, it's important to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember, it's not safe to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.